Getting exceptional images is so important for case acceptance that if your images are not great, I will guarantee you are leaving money on the table in your TC room. Because if you follow digital co-diagnosis, presenting care in orthodontics should be a slam dunk. Hello there, Orthopreneurs, and welcome to another episode of your 5-Minute Friday. Today, I want to talk about clinical photography. Now, you guys may know this already, but I taught clinical photography, traveled the world, many continents, from as early as I think about 2000-ish or so. I was the guy paid in the room in front of 1,000 people to be the expert in clinical photography. And I took it seriously. I learned everything there was to learn. The stuff I learned from my mentor, Dr. Ward Smalley, who is exceptional at clinical photography, I took it and took it to the next level. And again, I see questions on Orthopreneurs and other groups every day about clinical photography. And nobody wants to listen. Your team is not taking the photos you want them to. You don't really know what you're doing. You weren't really taught in school how to do it. And I'm just trying to sit here and tell all of you, getting exceptional images is so important for case acceptance that if your images are not great, I will guarantee you are leaving money on the table in your TC room. Because if you follow digital co-diagnosis, which I've talked about so many times, I'm not going to rehash it here, presenting care in orthodontics should be a slam dunk. Again, let's go through that. At the end of the day, when I was a restorative dentist, people came to me for a cleaning, thinking that's all they needed, and I would find decay around fillings, broken teeth, and I had to sit there and tell patients who expected nothing else that they needed $5,000, $10,000, $50,000 worth of dentistry. Now, when you're doing that, you'd better be able to make a good documentation in photographs so they can see it and learn from it. And that's where I invented the concept of digital co-diagnosis, which I've been using for literally 2.5 decades. And I've taught it around the world. And it helps you transform case acceptance from, hey, do you see this problem here? To a patient telling you, hey, I want to talk about this problem. There are verbal skills you need to get through. But it all starts with exceptional clinical photography. And if your photography is mediocre, it doesn't work. And you're leaving money on the table. If there's one person a week on an average $5,000 case who doesn't accept, that's $250,000 a year that you're leaving on the table. And that's one per week. So if your case acceptance is already above 90%, stop listening now. But if your case acceptance is at 65, 70%, and you want to raise it, I've got a great answer for you. Orthopreneurs University, I did a course 2 years ago that will allow me to train your team in clinical photography. So you don't have to do it. Have them watch it as many times as they want. When you get a new hire, have them watch it. It's like $350 or $400. It's cheap. It's the best money you'll ever spend. But on it, I go through digital co-diagnosis. And for the doctor and your TC, it's required watching. I make all my TCs watch it when they start with me and periodically use it as a review. Because I go through step by step how we use the digital co-diagnosis solution to help people in a moral and honest way understand that it's their problem and we'll help them solve it. So again, you just go to orthopreneurs.com because you're going to sign up for Summit anyway, right? When you go to orthopreneurs.com, click on Orthopreneurs University, and you will find my Clinical Photography 1 and 2 class. And in there, I actually show you in number 2 how to use an iPhone or an Android or a Google or whatever you got to shoot clinical images and a whole bunch of reasons why you might want to do that. So go to orthopreneurs.com, go to Clinical Photography within Orthopreneurs University, and I promise you, I guarantee, if you don't think it's the greatest class you've ever taken on clinical photography and how to present care, just message me. I'll make sure you get every penny back. All $350 or $400, whatever it is. But I'm promising you, if you can get great images and start using digital co-diagnosis and have me train your TC in clinical photography and digital co-diagnosis, you should legitimately see a return on investment of probably somewhere between 3 and 500x. Yeah, you heard that right. If you do it right, you should make at least another $150,000 a year, minimum, maybe much more, depending upon your patient flow. So go to orthopreneurs.com, click on Orthopreneurs University, and go look for my clinical photography course. And I promise you, it'll be the best course you've ever taken for clinical photography. And you and your team will be trained by me. And I promise you, The approach, the techniques, the positioning will allow you to take a full set of images in literally less than 2.5 minutes, and to do it in such a way that you wouldn't be ashamed to put them on a screen in front of 1,000 people. You know why I say that? Because I was the guy who had to do that. And on that course, I'll show you how I take a full set of images live on a subject. So again, why do clinical images matter? Because you can use them during digital co-diagnosis. Why does digital co-diagnosis matter? Because it's going to increase your case acceptance, make you more money, and most importantly, get a really well-informed patient, which means not only are they going to start with you, but if they don't start with you, they're not bad-mouthing you. They understand exactly what their needs are, and they just chose not to get started. So go to orthopreneurs.com, go click on that, go learn more about it. I'm always here if you have questions, but if it's a question that can be answered on the DVD, or not DVD, it used to be a DVD. If it can be answered online on that course, I'm going to refer you there, all right? Much love to each and every one of you, and wishing you a great day.